Then we look at Stannous Fluoride and ACP, which is a product called Enamelon. Many of you have heard or used it. It's a product from Kaminer. It has elements inside to make it substantive besides the fluoride and the amorphous calcium phosphate. So it also sticks around. And I think it's a very important point. Many manufacturers put amorphous calcium phosphate in products. Yet, if you ask them how much bioavailable amorphous calcium phosphate there is, if they're honest with you, there's probably not very much. In order for ACP to be bioactive, to have an effect, it's got to be substantive in the oral cavity. And Enamelon has chemistry inside that allows for substantivity. So you're delivering a tremendous amount of stannous, amount of effective fluoride, which will help in desensitization, and with the ACP also help in remineralization. Now, our office did a study a number of years ago for Kaminer where we tracked 40 patients who are extremely sensitive and asked them how quick after using Enamelon do they feel less sensitive. And the average was about 3 days. So that's how fast, how rapid Enamelon can work. It comes as a treatment gel, a gel that's great for sensitivity reduction and white spot treatment. It also comes in a toothpaste for maintenance and improved sensitivity reduction. So when our patients were sensitive, we used the treatment gel. You had to apply it with their finger. You can make them a custom tray. Any of those things will work, and have them wear it for 10 or 15 minutes nightly for sensitivity, and it'll work substantially. So the one thing you have to note is because there's Stannous Fluoride, in long-term use, and I repeat, in long-term use only, you will have some staining of teeth that will be easily removed during prophylaxis in the office. But here's what's very compelling. Enamelon, after 1 day on the left, begins to slightly occlude the tubules, as you see here. But after 10 days, 10 applications, 5 days, 10 applications twice a day, you can see the tubules being occluded. So it makes sense that our patients began to see sensitivity reduction quickly. It correlated with this particular study, and I strongly encourage this product for people that are really, really sensitive. So it has this great combination of Stannous, which protects against the acid challenges and occludes the dentinal tubules, and the ACP, which, when working with the Stannous, helps reduce enamel solubility and also helps to occlude the tubules, kind of the best of both worlds. White spots are a common occurrence in our office. We see this all the time, and patients come to us and they ask us, how do you fix the problem? So if I ask one of my friends in this group, let's say Ducky who's here, how do you fix this problem? Ducky might say to me, I could do composite veneers, I could do porcelain veneers. Those are both viable options. The problem with composite veneers is that if you're not really, really skilled and you don't remove some tooth structure, you're likely going to see a white spot that peeks through the composite veneer. You could do porcelain veneers. If you do porcelain veneers, you're going to have to cut down the teeth, and these teeth, I'll go back with no prep. You might be able to get away a little bit here, but as a general rule, you're not going to get away with no prep on these things unless you're making the veneers really, really opaque. What happens if you whiten the white spots? Well, if you whiten the white spots, they only become whiter. That doesn't work. But what if you could remineralize the white spots? If you can make those white spots revert, look better, actually grow enamel, if you will, or change the topography or chemistry of the enamel.